Welcome to MC's Anatomy 101, where we will be learning movements. Flexion is on the sagittal plane, and in the limbs, flexion decreases the angle between bones. This can often be seen in movement between the wrist to the chest, from the heel to the butt, the thumb towards the palm, and chin to chest. Extension is movement in the sagittal plane, and in the limbs extension increases the angle between bones. This can be seen when you straighten your elbow, knee, straighten your wrist, or in your hand when the thumb moves away from the palm of the hand. This can also be seen when you move your chin. Hyperextension is abnormal or excessive extension of a joint beyond its normal range of motion, often resulting in injury. This can be seen here in Bryce Harper's knee injury in the 2017 season. Here, he hyperextends his knee, which causes it to move backwards and therefore injuring himself. Rotation is generally the movement of a limb surface away from the midline of the body. Rotation of the neck or body is the twisting movement produced by the summation of the small rotational movements available between adjacent vertebrae. Rotation of the limb so that the anterior surface moves away from the midline is lateral or external rotation. Movement that brings the anterior surface of the limb towards the midline of the body is called medial or internal rotation. Abduction occurs on the coronal plane, medial to lateral, and is moving the limb laterally away from the body or bringing the fingers or toes apart. An example of this is raising the arm laterally upwards or spreading the fingers apart. Adduction also occurs on the coronal plane, but is lateral to medial. It is moving the limb medially across the midline of the body or bringing the fingers or toes together. An example of this is lowering the arm laterally downwards. Another example is bringing the fingers together. Circumduction is the movement of a body region in a circular manner, in which one end of the body region being moved stays relatively stationary, while the other end describes a circle. It is a combination of flexion, adduction, extension, and abduction at a joint. An example is biaxial condyloid and saddle joints, such as moving the finger or the thumb in a circle. Dorsiflexion is the movement of the ankle joint. It is lifting the front of the foot so that the foot moves towards the anterior leg. An example of this is standing on your heels. Another example is while your legs are suspended, pointing your toes upwards. Plantar flexion is the movement of the ankle joint and is lifting the heel of the foot from the ground or pointing the toes downwards. An example of this is standing on your tiptoes. Another example is while your legs are suspended, pointing toes downward. Inversion is the movement of the intertarsal joints. It is the angling of the foot so that the medial foot rises off the ground. The foot has a greater range of inversion than eversion motion. An example of this is standing on the outside of the foot. Eversion is the movement of the intertarsal joints. It is the angling of the foot so the lateral foot rises off the ground. These are important motions that help to stabilize the foot when walking or running on an uneven surface and aid in the quick side-to-side changes in direction used during active sports such as basketball, tennis, or soccer. An example of this is standing on the inside of your foot, as can be seen here in shifting feet. Supinated position is an anatomical position when the palm faces upwards. Here, the radius and ulna are parallel, as can be seen in the left picture. Supination is the movement from pronated position to supinated position. The radius and the ulna go from crossed to uncrossed. A common way to memorize this is that supination is what you do when you scoop up soup with a spoon. Pronated position is when the palm is facing downward, and the radius and ulna form an X due to the slight curvature of the diaphysis of the radius, causing the radius to cross over the ulna. Pronation is the movement from supinated position to pronated position. The radius and ulna go from uncrossed to crossed. Pronation occurs when you throw a baseball, most often while pitching. This can be seen here from when the outside of the hand faces backwards and then turns to face forwards. Opposition is the thumb movement that brings the tip of the thumb in contact with the tip of a finger. This movement is produced at the first carpo-metacarpal joint, which is a saddle joint formed between the trapezium carpal bone and the first metacarpal bone. Thumb opposition is produced by a combination of flexion and abduction at the thumb at this joint. Returning the thumb to its anatomical position next to the index finger is called reposition. Special thanks to Lumen Learning, Ms. Bennett, and also my legs for always supporting me. Thanks, legs. Specifically you, Edith and Agatha. And my favorites, Joseph and Klaus. Love you guys.